Hi, Cynthia Tieche here with Dr. Tieche from Recharge Clinic at our Ocala location. How are you doing tonight?
Wonderful.
Good. So we have some fun stuff to talk about today. We're going to talk about ketamine infusions. And for most people, they don't even know what that is, really. But there are some ketamine infusions clinics starting to pop up, so people are becoming a little bit more aware. But for the most part, I don't think many people know exactly what they are. So let's talk about what is a ketamine infusion. Why would someone want it?
Well, let me go back to what ketamine is. So ketamine has been used as an anesthetic. It's a general anesthetic medication, as well as it's in a classification called a dissociative anesthetic. So what that means is the way it works, it's used a lot in veterinary medicine to sedate dogs and horses, and it's also used in humans to sedate them or put them to sleep, actually. And what it does is it kind of disconnects the brain from the body as far as that. So that's what's called dissociative. And so it's been used for many, many years. It really was one of the first ones that has come out. It was used with it's very safe medication. It's been used for a long time. But then there were a lot of studies done with it at different dosages to treat other things. We knew that in low doses you could do painful procedures to people and they were able to tolerate it. But then afterwards they had sustained or long-lasting pain relief. So they tried this on lots of different people for different medical problems. And one of the things that showed incredible promise was using ketamine in low-dose infusions for depression, refractory depression. That means depression that has not responded to traditional medications, whether it just be counseling, lifestyle alters, or even antidepressants. And so it's been very promising because really these people suffer and are on numerous medications. Some of them are unable to function and have to have like ECT treatment, electroconvulsive treatment to try and get them out of that depression. So it's been showing a lot of promising results.
Wait, so ketamine getting it one time will help someone with depression?
It can, but honestly, typically that it can help that. So the answer is yes, but typically people need a series of infusions to get maximum benefit. And really, most people kind of make the decision after 3 infusions, spaced about a week or so apart, or several per week or a week apart. And not only does it really just help with depression, but it helps with certain types of anxiety disorder, panic, things like that, as well as chronic pain. So it's shown a lot of promise with that. They've even tried to develop a pill form of ketamine, but it hasn't been released yet. There is a nasal spray of a medicine that's very similar to ketamine, but is not ketamine. And that's just been released. It's very, very difficult to use. It's only used in kind of research.
It's got to be like highly controlled.
Yes, because I imagine it's a nasal spray, and so it can have a lot of effects. So that's out there. But so ketamine infusions are starting to gain popularity around the country, and people are seeking treatment. People who have even just mild depression, mild anxiety, or up to severe, and are getting these infusions to try and help them.
So for depression, but it's not just for depression, right? No. It's for many other things. But let's talk about that a little more. So, so someone who may have some type of form of depression would come in, get a ketamine infusion, one or a few in a row, maybe every week or more than once a week, and it really helps with depression. How?
Well, that's the big mystery. How does it exactly work? Well, and I don't know that anyone knows. The current theory is that it resets all of the neurotransmitters in the brain. So it kind of resets everything at once and kind of gives you a fresh start. So that's really
awesome.
It is. We have had some really great success, really with PTSD patients who were able to totally recount their things and actually process that information step by step.
So when you say recount, you mean like remember everything that they went through and kind of process it? Like
one person was very disturbed because they had an accident and were not able to remember and process all of it. And so they kept having nightmares about
it's like therapeutic.
Yeah, the gaps of their accident and the treatment thereafter.
Wow.
When they got the ketamine, they were actually able to go in slow motion in their brain and recount every aspect of it and deal with it and think about each one and look at it and analyze it and realize what had happened instead of having these big gaps in their memory that were haunting them.
That is crazy.
Yeah, and so it was pretty impressive because I sat with him and he was able to recount everything. I mean, even in very much slow motion, like he was on a motorcycle and he hit a car and he could remember himself going through the air, hitting, the ambulance coming, everything, which he never had any recollection. He didn't know what happened. He didn't know anything that happened until he was ready to be discharged from the hospital. So that really bothered him. So then he could remember all. He could remember his time in the hospital, people that visited him and everything.
So you say you sat with him. So when you get this ketamine infusion, are you asleep or awake or?
Really, it's kind of a trance. So when people get deep ketamine infusions, like for anesthesia, you are completely asleep and pretty much unresponsive to pain. Now, these are much, much lower doses. So you go into a state of sort of suspended consciousness. I mean, you are awake, but you're very sedated. And of the people that have had them, there's been variable response. Some people kind of nod off a little bit. They're not quite familiar with where they are, but you can talk to them and they can answer you, recognize you. This gentleman got the infusion and honestly, I couldn't tell that he had got anything. And at one point I really was questioning whether there was anything in the bag, whether I gave it to him, because he was very lucid, very clear, but he said he knew he was getting it. And so you don't go completely asleep. We do, kind of put you in a darker, quiet room, to let you process your thoughts and kind of be with it. The infusions take really anywhere from 30 minutes to several hours, really, depending on the dosage and really the patient's comfort level with it, because some people feel a little uncomfortable with it at first because it's a different experience.
That's crazy. I mean, that's really something that would probably really help people who are going through therapy and can't remember things.
Well, that's one thing for sure. I mean, I think the other thing that is really important is the people who have depression that is not responding. That's a frustrating thing for practitioners who have patients that are not responding to that, to the depression. I mean, basically that person's life is affected, plus the rest of their family and children or whatever, and it's very incapacitating. And so to have something that's relatively simple to do and has been having some really positive results is kind of another nice option to have.
To me, sounds a little scary. Is it safe? I mean, to really go and get this infusion of this, you're a doctor, so you're very familiar with it. You're like, oh, it's simple. But for me, I'm like, whoa, what are you putting in me? I'm going to be in what state?
And that's true. And for me, it is even one more step above that because I used to be an anesthesiologist. I'm very comfortable and familiar with giving people infusions and sedating them and seeing them at all levels of consciousness down and up. So I am very comfortable with it and I know what to expect from it because I've used ketamine quite a bit. And so now using it, I'm very at ease with it. I don't know, other practitioners, how they do it. I would hope that they would have had a similar experience with it. So I don't know that I would just go to like a 7-Eleven and get a ketamine infusion.
7-Eleven.
But, yeah. But, a lot of things just pop up and people go to a course and then they try to do it.
So be wary of going to a ketamine.
I would see what someone's
clinic.
Experience level is because you do need to be monitored. Most people are put on an oxygen monitor and a blood pressure monitor and all these other kinds of things because you never know how someone is going to respond. I mean, you are giving them a potent medication. And so not only is it while you're giving it to them, but when they start to wake up or come out of it, they also feel a little bit different. So they have to be observed for a little while. They can't just jump up and leave and say they're done. They have to get their legs back. They get little sea legs when they're having the infusion. So they have to kind of wake back up again. And so that's part of, the whole process.
So we'll talk more about, if you're not in this area, to come see Dr. Tieche, we'll talk more about how to find a good ketamine clinic at the end of this. But let's talk about the next thing. So talk about depression. You also said it's good for pain.
Right.
So let's talk about that. How?
There's people who have chronic pain basically is another thing that, is very difficult to treat. And we're using lots of medications, that are all based on kind of a seizure type medicine. There's Dilantin, Gabapentin, Neuron, all those things were used and they kind of dull the neural transmission. And so basically they kind of slow it down to blunt it so that your pain is relieved when it's not able to be fixed. And so ketamine kind of works along that way too, by resetting things and hopefully decreasing it. While someone is getting the ketamine infusion, they are completely pain-free. I can tell you that. It is that potent that they don't have any pain. Now, the thing is that we want to see is how long does it last afterwards.
Yeah.
So some people have, a very quick return of their pain, but some people have longer and longer periods of it. So we've done it for back pain, where people have gotten complete relief of their pain until some other incident may bring it back again. But, that's pretty promising for people who have just bad back pain that, they can't have surgery for, or they've had surgery and they still have pain. They don't really want to take a ton of medications. And so it's really been very successful for that. So it's just another approach. It's one more thing to try. And I think it's really a nice thing to try, both for depression and for pain, because many people feel they lose hope at that point, and they feel desperate. They said, listen, I've been to everyone. And unfortunately, some of the providers who don't know about it would just say, well, there's nothing more we can do. And so, now these people have lost hope.
Like most other providers, not just some, pretty much most.
Probably. And so the reality is, once they've tried some of this, I mean, it's, even if, and this is the common thing too, is when we talk about the infusions with people is, it might not get rid of 100% of your pain, but, it may get rid of 10% or 50% or all of this stuff. And so, when someone has a large amount of pain or depression and it's very much taking over their life, to remove a portion of it is still quite an improvement.
Definitely.
So not everyone has expectations to lose 100% of their pain or get rid of 100% of the pain. So sometimes just getting rid of a portion of it helps.
So, I'm sorry, we have a comment on here, a question, so I'm trying to hear that, and my phone wants to put the sound on for some reason. So, if you have a question about this, please do comment on here, and I'm trying to read the comments now without turning my sound on, but it's still. Would you check the comments for me and let me know what question we have? So, is there a question? Okay. So for people who are coming in for pain, so they're definitely out of pain while they're getting the infusion, but this could last weeks, months, or you said take away their pain until they re-injure themselves or whatever.
Correct.
That is something. What kind of success rate do you really have with that, though?
Well, it's variable. A lot of these things are, depression probably is the most successful, but it's not 100%. Pain is another one that people have a lot of success with, but again, it's not 100%. So it's one of those things that you can't really predict, and that's the frustrating thing.
But you have nothing to lose at this point.
Correct. And so you can't really predict who's going to be a great responder and who's not. And that's the frustrating thing, because of course, we would only pick the people who are going to have perfect results.
Yeah.
And the same thing with most medical treatments. You don't know. Sometimes it's a little bit of trial and error, which is a frustrating thing to hear, particularly someone who's already been through a lot of stuff and saying, well, how do I know? And I don't. And I try to be as honest as I can. I don't really want to misinform anyone and mislead someone, because most people are very desperate and they would try anything if you said, yes, this is going to work. But that's not accurate. Right. I'm hopeful that they will be the one that gets rid of everything. Of course, I want that. But I and so it's hard to put a number on it, and I think that it's a case by case thing, and, but it's been showing a lot of promise. I think the data collection is becoming more and more, because these infusions are becoming much more popular. There's more places that are performing them.
I see.
So the amount of people that are getting it is going to increase, so the results are going to, show up more. The other thing that's going to happen as well is, that's what's going to happen. Yes.
So, do you feel like this is, I know we talked about it's safety while you're going under and that you have to go to someone who knows how to do this, but do you feel like for your body, like as far as being healthy, that this is okay? For someone who's really like all about health, who doesn't really want to take a bunch of medicine, is this going to be okay for them, or?
Well, I don't think there's any long-lasting effects of the ketamine in your system, so it's not really a poison or a toxin in that way. I think when you think about, the greater good and the, one thing better than the other, people who are on multiple medications, whether it be for pain or depression, really always say the same thing. They want to be off of them because they, maybe not bad, but they do have some unpleasant side effects. Plus, they are a foreign substance that you're taking all the time. So to answer that question, is this something that someone who's concerned about their health, should they do it? Well, most of the people that come here are that way, and they're trying to improve their health and well-being, and they are trying to get off medication. So that is one of their goals, is to try and get off something that they may be on the rest of their life, which may only marginally help. So they're taking a pill every day to try and get rid of that. So that's really the goal ultimately. Does that always happen? Of course not. But we don't know who's going to be the one that responds and who doesn't, So that's what it is,
Okay.
And I mean, so I think the answer is no, it is not a dangerous thing to get. No, it is not toxic. No, it has no long-term side effects as far as affecting your mind or anything like that. So I think it is very safe in that way.
Okay. So if someone is not in the Central Florida area and they're watching this video and they would like to get a ketamine infusion, how should they find somewhere that's safe and has someone who is like, what would a good clinic look like?
Well, so what the clinics have kind of broken down to is initially a lot of the ketamine infusions were given with lidocaine infusions, and they were done at pain clinics. They were done by usually pain doctors under their supervision because they would use different dosages. So those people were generally experienced with using these medications. But it's spread out to other people, and other people are doing it. So, to say I'm going to go to an IV clinic and get a ketamine infusion, if there's someone who's not that experienced with ketamine, I probably wouldn't do that, nor would I recommend that. So I think that you have to do a little research on the center that's doing it. What is their training in it? Do they know how to do it? Do they have are they comfortable using that medication? Because it's not the same as giving a vitamin infusion. It's not the same as some other things. And so it's the real deal. And it has some great effects, but, used in the wrong dosages and the wrong infusion rates, you could have quite a problem. So I'm not trying to scare people, but let's be informed.
Well, it's serious.
It is a serious thing. It's a serious medication. It has some really great side effects, but used incorrectly, it can have some really bad side effects. So I think you want to be as informed as you can, not just say, okay, I know how to spell ketamine, so I can give a ketamine infusion. And that's, it needs to be more than that, but there are some people that are just basically doing that. And So just because someone's legally allowed to administer ketamine doesn't mean that they probably should administer. That's ketamine. True of many things in life. Yeah. Just because they can doesn't mean they should. And so, but there are many people, on the flip side of it, there are many people who are trained to use ketamine. There are actually ketamine courses put on by, the providers that have done this and teaching other people the protocols and how to do that. So it can be done safely. I don't want to make it that everyone that does it doesn't know what they're doing, because there's lots of people doing it. And yes, there are a lot of people that know what they're doing. Just as with everything, as everything kind of gets out there, with everything that we do in medicine, there's people who are trying to find a shortcut and to get into that and do it just because they want to, add another service. And so that's all. We just want people to be safe and get great results. Yeah, because definitely. The people who get bad results are only going to bring it down for everybody else. Yeah. And that's going to make it be a bad thing. That stuff spreads like wildfire. Oh yeah, a friend of mine had a ketamine infusion. They had a really bad experience. They hallucinated. They did this and that. And, maybe it was avoidable. And so now someone else has to spend 4 hours trying to tell someone about a ketamine infusion, which, they would have just gladly tried, but they have these bad experiences or had someone who had a bad experience. Do you think that it should be a doctor, or are there qualified nurses that can be administering these? Well, it started out that it was mostly doctors. Then there was a subgroup of nurses that set up some clinics that were nurse anesthetists. So they were. So what's a nurse anesthetist? So that's a nurse that has a master's degree in anesthesia. They administer anesthesia. So I believe that they would be very qualified to do that because they give a lot of infusions. They know people's level of consciousness and sedation. So there were many of those that kind of were under a doctor's
So they
supervision.
definitely know this.
But they know, they would be
Mhm.
very comfortable being aware of problems. So I don't think it necessarily has to be a doctor, but I think it probably has to be someone who's very experienced with these medications. Just because it's a doctor doesn't mean anything, because any doctor can order ketamine and any doctor can give it. That doesn't mean he has the qualifications to do it. So it's very easy, it's easy for a doctor to get this medication. And so if they don't know, they may just feel puffed up that they know and say, well, I'm a doctor, I can pretty much do anything. Then that's where the problem is going to lie, to make sure that that person has some training in that and all of that, because I can tell you, many doctors don't. There's some that do, of course, but there's, and so just to say, well, it's a doctor that they get a clean pass, no. And just because they're a nurse, they don't, no. So it depends on that person's previous training, and that is what I think is important, to know that their level of comfort with this stuff and knowledge base about how to take care of someone. That's the most important things. So.
Awesome. Is there anything else that ketamine is good for that we missed? Pain, depression? Those are the main things?
Those are the main ones that people are using these ketamine infusions for. I believe that they'll probably be used for more as people just become a little bit more comfortable with it, because as we find things, pretty much in functional medicine, we try a lot more stuff for other things that just sort of fits outside the barrier. I think people are going to try it more for fibromyalgia, for Lyme's disease, chronic fatigue. There's no doubt with that. It's kind of that's a gray area, and I think those people need to know that it may or may not work. But I can tell you, just talking to many of those people, they're willing to try it because they're very desperate and they've had no success with traditional medicine. Because if they did, we wouldn't be having the conversation.
Yeah.
And so I think as people hear about it more and learn about more, they're probably going to want to try it for things that are on the edge a little bit. I think there's some things that you can't do it for, and that has to be very clear. There are certain mental conditions you cannot give ketamine for, certain blood pressure issues you can't give ketamine for. But, someone who knows about ketamine would know those things.
Okay.
Or should know those things.
Should. All right. Anything else you want to add?
I think it's a really nice addition to treatments of depression and pain. I think it's an awesome addition into many other things that are available, such as medical marijuana and things like that. And I think done safely, it can really provide a lot of benefits. And it's just it's another nice thing to have. And now it's being offered more available in more areas, so that I think it can help more people.
Awesome.
And so that's what I think is really a really promising thing about it.
Well, exciting. So if you're interested in this and you're anywhere near Ocala, the Villages, anywhere near this Central Florida area, and you'd like to come, you can definitely message us. You can call us. We'll have our website up on this post later. But if you're not in this area, some good tips to finding a good, safe ketamine clinic near you if you've got depression or pain, because we have really seen really good results with our patients. So thank you for watching. Our website is rechargeocalaclinic.com. And feel free to go on there and see everything that we do if you've never experienced what we do at Recharge Clinic with Dr. Tieche. Thanks for watching, and share this on your page.